Greetings, my friends. Today's lecture will be about genetics, specifically about chromosomal diseases. Bezrukov Grigory Sergeyevich, Doctor of Philosophy in Medicine. Human chromosomal diseases. Human chromosomal diseases are caused by genomic or chromosomal mutations. Chromosomal diseases result from mutations in the germ cells of one of the parents. More than 800 chromosomal syndromes are known. Chromosomal diseases are diseases the development of which is due to a change in the number or structure of chromosomes. That is to say, karyotype alterations. Karyotype is a set of chromosomes in a somatic cell characterized by number and structure. Normally, any somatic cell contains a diploid set of chromosomes. The diploid set includes 23 pairs of chromosomes, of which 22 pairs are autosomes, 1 pair sex chromosomes. Gametes, which are known as reproductive cells, contain a haploid set of chromosomes, 22 autosomes plus 1 sex chromosome. Heinrich Wilhelm Waldeyer. He introduced the term chromosome to denote the colored filamentous structures that are visible during meiotic cell division. Seton and Boveri come to the conclusion that chromosomes are carriers of hereditary informations, which are known as genes. This discovery formed the basis of the scientific direction studying human chromosomes in normal and pathological conditions, cytogenetics. Levitsky Grigory Andreevich created the first guide on the material foundations of heredity. The works of this scientist on the study of chromosome morphology laid the foundations of the world and domestic cytogenetics schools. Later, in discussions with Navashin and Delaunay, the terms karyotype and ideogram were first introduced. An ideogram is a schematic representation of a haploid set of chromosomes of an organism, which are arranged in a row according to their size. A graphic representation of individual chromosomes with all the structural characteristics. 1928 year, one of the founders of genetics in Russia, the founder of the Institute of Experimental Biology in Moscow, organizer and head of the Russian Eugenic Society, author of the idea of matrix synthesis. Koltsov Nikolai Konstantinovich. He was the first to formulate a hypothesis about the molecular structure and matrix reproduction of chromosomes. Barbara McClintock is an American cytogenetic scientist, winner of the Nobel Prize in Physiology or Medicine, author of many fundamental discoveries in cytogenetics, including the recombination of hereditary information as a result of crossing over, described the physical properties of chromosome regions, showed the role of telomeres and centromeres. Crossing over is the exchange of homologous loci between homologous chromosomes during conjugation in prophase 1 of meiosis. She was at the origins of human cytogenetics. Prokofiev Belgovatskaya Alexandra Alexeyevna. She managed the laboratory of human cytogenetics at the Institute of Human Morphology of USSR Academy of Medical Science, the author of the concept of asynchronous functioning of the chromosomes in the cell nucleus, author of the monograph Heterochromatic Regions of Chromosomes. Swedish scientists Theo and Levan established the number of chromosomes in humans in the norm 46. From 1961 to 1973, Albert Levan was a professor of cell biology at Lund University, where he headed the laboratory of cancer chromosomes at the Institute of Genetics. He is known as co-author of the report from 1956, which states that people have 46 chromosomes. Previously, he believed that there were 48. The report was made jointly with Joachim Thier. Frequency of human chromosomal abnormalities. Early preimplantation losses, about 50%. Spontaneous miscarriages, up to 70%. Stillbirths, 5%. Congenital malfunctions, or which are known as malformations, 8%. Multiple congenital malformations and mental retardation, 5 and 5%. Infant and child mortality, 7%. Mental retardation, IQ below 20, about 3 to 10%. IQ from 20 to 49, 35%. IQ from 50 to 69, about 3%. Male infertility, 2%. Violations of sexual differentiation, 25%. Disorders of pubertal development in girls, 27%. Habitual miscarriage of pregnancy, 8%. Classification of chromosomal abnormalities in humans. 1. Genomic mutations. Change in the number of chromosomes. Polyploidia, aneuploidia. 2. Chromosomal mutations. Changing the structure of chromosomes. Deletion, loss of a section of chromosome. Duplication is the doubling of a section of a chromosome. Inversion, rotation of a chromosome section by 180. Translocation is the attachment of the section or an entire chromosome to another chromosome. Polyploidia, an increase in the number of chromosomes by a multiple of the haploid set of chromosomes. Two types of polyploidia have been described in humans. Triploidia, tetraploidia. Causes: total non-disjunction of chromosome in gametogenesis in parents, resulting in the formation of the abnormal gamete containing 46 or 69 chromosomes. Fertilization of an ovum by 2 or 3 sperm cells. Aneuploidia, a change in the number of chromosomes by a value that is not a multiple of the haploid number of chromosomes. Monosomia, trisomia, polysomia, which is the presence of 2 or 3 additional sex chromosomes. Autosomal trisomies, sublittle, little, and especially little. General patterns of clinical manifestations of autosomal syndromes. Prenatal hypertrophy, malformations of 2 or more systems, marked delay in psychomotor development, numerous microanomalies, limited life expectancy of patients. Down syndrome, trisomy on the 21st chromosome. Population frequency, 1 to 700 newborns. John Down. For the first time, he described Down syndrome under the name mongoloidism. True established that this syndrome is congenital, but mistakenly associated with parental tuberculosis. In 1887, Down published the monograph The Mental Illness of Children and Adolescents. This scientist was the first head of the Department of Fundamental Genetics in France, a member of many academies, the owner of the large number of scientific awards. In the late 50s, he discovered that the cause of Down's disease is trisomia 21, for which he was awarded the Kennedy Prize in 1962. Cytogenetic variations of Down syndrome. Simple trisomia, 95%. Translocation option, 3%. Mosaic option, 2%. Simple trisomia is the metaphase plate 47, separately lying chromosomes, of which the 21st. The reason for the birth of a child with irregular trisomy 21 is random non-disjunction of chromosomes in 21 pairs during gametogenesis in one of the parents, more often in the mother. Risk factor is mother's age. Translocation variant. The presence of 47 chromosomes in metaphase, of which there are 21 chromosomes plus translocation. That is the linkage of two chromosomes. One of the parents is a carrier of a balanced translocation. The prognosis is unfavorable. Mosaic version. Mosaicism is a condition in which different cells of the same organism contain a different set of chromosomes. The clinical picture: prenatal hypertrophy, muscular hypertension, brachycephaly, flattening of the neck, flat face, flat nose bridge, mongoloid incision of the palpebral fissures. Malformations of the internal organs. Congenital heart defects, gastrointestinal tract, dysfunction of visual and auditory analysis, endocrine disorders, immunodeficiency disorders. Physic disorders, oligophrenia of varying severity. Intelligence quotient in IQ, 25, maximum 75. Average life expectancy, 35 years. Edwards syndrome is the trisomia on the 18th chromosome, described in 1960 by Edwards. Population frequency, 1 to 7,000. Cytogenetic variants, simple trisomia, mosaicism. Edwards syndrome clinic, severe prenatal hypertrophy, dolichocephaly, microphthalmia, low position of the ears, blepharophimosis, facial clefts, narrowing or absence of the external auditory canal, short neck, finger overlap, foot deformity, which is known as rocking foot. Here you can see the clinic of Edwards syndrome. Edwards syndrome. In 90% of cases, congenital malformations of the heart and large vessels, brain defects, hyperplasia of cerebellum and corpus callosum. In 50% of cases, malformations of gastrointestinal tract, esophageal atresia, incomplete intestinal rotation, ectopia of the pancreas. Urinary system, doubling of the kidneys and ureters. Horseshoe kidney, obliteration of the ureters, and boys usually have cryptochildism. Most patients die, unfortunately, before 1 year due to severe malformations of intercurrent infections. Patau syndrome is the trisomia on the 13th pair of chromosomes, first described by Patau in 1960. Population frequency 1 to 7,000. Cytogenetic variants, simple trisomy, translocation VT. Patau syndrome clinic, parental hypertrophy, microcephaly, trigonocephaly, sloping forehead, narrow palpebral fissures, microphthalmia, wide base of the nose, sunken nose bridge, deformed ears, cleft lip and palate. Patau syndrome. Polydactyly, syndactyly of hands and feet, clenched fist with overlapping fingers, long bulging nails, focal aplasia of the skin on the back of the head, shallow scrotum. Patau syndrome, malformations of the brain, holoprocephaly, arenacephaly, prosencephaly, agenesis of the corpus callosum and others. Heart defects in the form of septal defects, defects of the gastrointestinal tract, heterotopia in the pancreas of the spleen tissue, incomplete intestinal rotation, Meckel's diverticulum, impaired liver lobulation, pancreatic fibrocytosis. Malformations of the urinary system are characterized by enlarged kidneys with increased lobulation in combination with malformations of the ureters. In boys, cryptochildism and hypoplasia of the penis. In girls, doubling of the ureters and vagina. Chromosomal rearrangements affecting the sex chromosomes. Frequency 1 in 5 to 1,000 newborns. The absence of gross malformations of the internal organs. Diagnosis in some cases is carried out in the pubertal period. In some cases, the patient seeks medical help in adulthood due to impaired reproductive function. A slight decrease in intelligence occurs only in some patients. Some patients have very poor symptoms. The anomaly of the sex chromosomes that they have may not be diagnosed throughout their lives or may be detected incidentally. Leading in the clinic picture of these syndromes are deviation in the human genital area, abnormal development of the gonads, internal and external genital organs, impaired development of secondary sexual characteristics and fertility. Monosomia on the X chromosome or syndrome Cherevets-Turner. First described by Shereshevsky in 1925. In 1938, Turner singled out the main signs of this disease. Population frequency 1 to 2,000 or 1 to 5,000. Cytogenetic variants of Cherevetsky-Turner syndrome. Complete monosomia, 45. Deletion variant, 46x6 deletion of the long arm of the X chromosome. 46x6 deletion of the short arm of the X chromosome. And here you can see the mosaic variant. Newborn girls, excessive skin fold on the back of the neck, which is known as rebelled neck. lymphedema on the dorsum of the feet. Here you can see the Chervetsky-Turner syndrome, how it looks like. Growth retardation, body type, brachymorphic, stocky, increasing the width of shoulders and chest, hypertelorism of the nipples of the mammary glands, eye hypertelorism, cervical pterygium, antimongoloid slant of the eyes. Here you can see how the rebelled neck looks like and how look antimongoloid slant of the eyes. The leading symptom of gonadal agenesis, it is the absence of ovaries. Primary amenorrhea, absence of menstruation. Irreversible infertility and lack of secondary sexual characteristics. Treatment. Before puberty, symptomatic treatment aimed at stimulating growth, like anabolic steroids. Somatotrophic hormone is not prescribed because there is no lack of it in the body. And after puberty, hormone replacement therapy. X chromosome polysomia in a male or Klinefelter syndrome. First described by Klinefelter in 1942. Population frequency 1 to 5,700 newborn boys. Here you can see the cytogenetic variants. Approximately 5–10% have the mosaicism. Klinefelter syndrome, tall stature combined with a eucoid build. The position of flat on the female type. Hair is scanty or absent. Gynecomastia in 25% of patients. Hypergonadism and azoospermia. Structural disorders of chromosome, deletion, duplication, inversion, and translocation. Cri-du-Chat syndrome or 5P syndrome. Legine and Dr. Legine in 1963 described the syndrome. Its frequency is 1 to 45,000. Cri-du-Chat syndrome, larynx change, microcephalia, moon's face, hypertelorism, microgenia, epicanthus, antimongoloid slant of the eyes, high arched palate, flat bridge of the nose. Congenital heart defects, changes in the musculoskeletal system, severe mental retardation. Ring chromosome syndrome. The main clinical and morphological features are characteristic face, microcephalia, oblique incision of the eyes, retrognathia, and short neck. All patients have mental retardation, delayed psychomotor development. Wolff-Hirschhorn syndrome, which is known as partial monosomia. The population frequency is 1 to 100,000 due to deletion of a segment of the short arm of chromosome 4. Clinically characterized by microcephalia, coracoid nose, hypertelorism, epicanthus, abnormal auriculus, cleft lip and palate, anomalies of the eyeballs, antimongoloid slant of the eyes, small mouth, malformation of internal organs, followed by a sharp delay in physical and psychomotoric development. The viability of children is sharply reduced. Most die, unfortunately, before the age of 1 year. Orberly syndrome, or 13 IQ syndrome, caused by a deletion of the long arm of the 30th chromosome. The population frequency has not been established. Characterized by microcephalia, the absence of a nasal notch, epicanthus, antimongoloid slant of the eyes, a high arched palate, and low-lying deformed auriculus. There are lesions of the eyes and rectal atresia. Frequent malformations of the heart, kidneys, and brain. All children with Orberly syndrome are characterized by deep oligophrenia. Most patients with this syndrome die in the first year of life. Prader-Willi syndrome. 70% of patients have a partial deletion of the long arm of the 15th chromosome. In 5%, the disease is associated with other rearrangements of chromosome 15. Characteristic external signs: a skull with the frontal part squeezed from the sides, an almond-shaped section of the eyes, lowered corners of the mouth, small feet and hands. There is a mental retardation, behavioral disorders, physical development delay, short stature, hypotonia, and hypogonadism. D. George syndrome. Partial monosomia. The population frequency is 1 to 20,000. Patients have the following clinical features: defects in the development of the third and fourth pharyngeal pockets, leading to hypoplasia or aplasia of the thymus with T-cell deficiency and immunodeficiency. Heart defects and characteristic dysmorphic changes in the face. For example, short axis of the eyelids, epicanthus, wide short nose, cleft palate. Children with this syndrome are often physically and mentally retarded. Fragile X syndrome, or syndrome of Martin-Bell. The name of the syndrome is explained by a special form of the structure of the X chromosome, which has a clearly visible concentration at the end of the long arm. It is one of the most common causes of hereditary mental retardation in men. Approximately 1 in 2,000 births. Fragile X syndrome. Patients with this syndrome are characterized by some morphological features that are not always clearly manifested, like high convex forehead, large ears and jaws, large hands, enlarged testicles. Mental development values in terms of IQ, values from 30 to 65. So sometimes within the normal range. Speech is replete with repetitions. A kind of stuttering is often found. Children are characterized by motor disgibition and some symptoms of autism. Even with a mild degree of intellectual insufficiency, children hardly master the skills of counting and writing. Translocations and inversions cause a violation of gametogenesis and are the cause of violation of reproductive function, like infertility, recurrent miscarriage, and fetal congenital malformations. The diagnosis of chromosomal disease can be made on the basis of data from a cytogenetic study and analysis of the patient's karyotype. Indications for cytogenetic examination. prenatal hypertrophy, multiple congenital malformations, undifferentiated oligophrenia, violation of sexual differentiation, violation of reproductive function, the presence of a balanced chromosomal aberration in parents or SIPs of the proband. Thank you for the attention.